Yep.
All right. Hello, everyone. My name is Chenglin Hong. I am not a postdoc fellow. I'm a first-year PhD student at the Department of Social Welfare, working with Dr. Ian Holloway. And it's an honor for me to present my work, Sexually Transmitted Infection Testing and Associated Factors among men who have sex with men in China. Next slide, please. You can just keep clicking. Yeah, so a little bit about the background. In China, there's increasing concern about sexually transmitted infections or STI among MSM, and the prevalence of STI among MSM are constantly greater than the general population. And as we all know, STI testing is pretty important, as some of the STIs are asymptomatic, and untreated cases can contribute to further transmission. However, research found that lifetime STI testing was relatively low. A recent study in 7 cities indicated that only about 30% of sexually active MSM had ever been tested for gonorrhea and chlamydia. And however, looking at lifetime testing is not enough for a high-risk population, and more regular screening is needed to control the potential transmissions. And despite the low testing rate, factors associated with STI testing were not well studied, as previous study or research generally focused on STI testing and diagnosis as potential predictors of HIV-related outcomes. So significant gaps remain in our understanding of STI testing behaviors among Chinese MSM. And exploring the correlates of recent STI testing can help us to identify the subgroups of MSM who in need of targeted STI prevention services. Next, please. And lastly, the WHO recommended integrating HIV and STI testing or concurrent HIV and STI testing, which is not always the case in China, as most of the STI testing services are only available in hospital-based clinics, whereas HIV testing is more accessible in more diverse settings, such as CBOs. And comparing the history of recent HIV and STI testing can help us to quantify the missed opportunities of the concurrent testing and motivate the integration. Next, please. So with that, the aims of this current study is to determine the overall proportion of STI testing and diagnosis in the past 6 months among this sample of Chinese MSM, and also to examine the correlates of recent STI testing to identify specific subgroups of MSM for whom in need of additional STI services. And also we want to see whether the STI testing behaviors differ by HIV status. And lastly, we want to quantify the missed opportunities for concurrent HIV and STI testing by assessing the association between recent HIV and STI testing. By recent, I mean in the past 6 months. Next slide, please. Yeah, please keep clicking. Yeah, so we conducted a cross-sectional survey in 2018 on Blood, which is believed to be one of the largest and most popular gay geosocial networking app in China and globally, with more than 40 million users. And we conduct a survey in 4 provinces, 2 of them in Northeast China and the other 2 in Southwest. And the eligibility for the study was aged 18 and above and male sex at birth, and current Blood user and living in one of the 4 provinces. And for this specific analysis, we include cisgender men and also who reported had anal sex in the past 6 months. Next slide, please. So in terms of the results, in summary, about 35% of the sexually active MSM were actually tested for STI in the past 6 months. And among those who were get tested, the prevalence of STI was 16.5, and syphilis is the most common STI, following by genital warts. Next slide, please. So we used bivariate and multivariate log binomial regression to examine the factors associated with recent STI testing. And we found that MSM who are older being employed have more frequent condom use, and also in an ongoing relationship with either an HIV positive partner or HIV negative partner, and also use rash popper in the 6 months, are more likely to get tested for HIV. for STI. Next slide, please. And in terms of STI testing versus HIV serostatus, we do find that MSM who are HIV positive are more likely to get tested. This makes sense because the people living with HIV in China are required to attend a regular clinic visit to get their antiretroviral medicine in China, and most of the HIV care are based in the STD clinic in the hospital. Next slide, please. And when we look at the association between recent STI testing and HIV testing, we do find that recent STI testing was strongly associated with HIV testing. And almost half of the participants reported being tested for HIV in the past six months. Next, please. As you can see here. But I think what is really alerting here, as we can see, is for those who tested for HIV in the past 6 months, almost more than 43% of them didn't tested for STI. And about 16% of those who tested for STI were not tested for HIV. So there are some gaps between these two testing services. Next slide, please. So in summary, we found that in this sample of MSM recruited online, the recent STI testing rate remains low, ongoing efforts really need to be made to promote STI testing. And we do find that young MSM and current students were less likely to be tested for STI, and this is consistent with the literature, especially for students. And there's some perceived barriers, prevent this group of MSM from being tested, such as low awareness and willingness to get tested, and also costs, because in China, most of the students are not insured, and they cannot use, their parents' insurance or their partner's insurance. And also, discomfort to disclose their not only sexual orientation, but sexual behaviors in general to their providers. And lastly, we do find some missed opportunities to offer concurrent HIV and STI testing. As we mentioned, nearly half of those who reported HIV testing had not been tested for STI, and about 1 in 6 men who reported STI testing had not been tested for HIV. Next slide, please. So our study has some future policy and research implication. As currently, we don't have any formal STI testing guideline for MSM in China, so the policy need to be proposed to promote the STI screening, and efforts need to be made to promote STI testing among young MSM and students, and to examine the barriers. And as most of the MSM are now using at least some of the mobile apps as Blued for dating or hookup, this is a great opportunity for researchers and public health authorities to reach to the greater population, to disseminate healthcare information and facilitate testing services. And also, we need to examine the barriers to offer concurrent HIV and STI testing from the providers in the sexual health or STD clinic. Next slide, please. There's some limitations of this study. First of all, the MSM were recruited using the geosocial networking app, Blued, in 4 provinces in China. So the generalizability of the funding to the geographic regions in China and to MSM who don't use Blued is uncertain. And also our data were self-reported. So there's some social desirability bias and recall bias. And also in terms of the questions for STI testing, we didn't ask their lifetime STI testing or their testing frequency. But despite the limitation, our study provide insight into STI testing behaviors and evidence to provide the development of interventions to promote STI testing among MSM in China. Next slide, please. Yeah, with that, I want to thank all my mentors here and there, especially at UW, where I get my degree for MSW and MPH in global health. And I want to thank Dr. Aaron Sigler and Patrick Sullivan in Emory, who offered me this opportunity to work with them. and also my mentor in Holloway. And lastly, I want to thank all the participants for this study because we didn't provide any compensation or intensive, and yeah, really appreciate their participation. Next slide, please. Yeah, and thank you. And if you're interested in our study, please visit our HIP website and follow us on our social media. Thank you. And I'm open for questions.
All right, awesome job. Fantastic presentation. I know I have some questions, but I'm first going to go to the chat here. Looks like we have a question from Dr. Elgarin, wondering if there are any geographical differences that you noted in HIV and STI testing.
Yeah. Thanks for that question. Yeah, we do want to examine whether there's some geolocational differences. So I think that's one of the aim we designed the survey in the two regions, but we do not find any differences in HIV or STI testing behaviors across these two regions. Yeah.
Interesting. Okay, another one from Dr. Shabta. What linkages, if any, to substance use, especially for stimulants, is there in seeking STI and HIV testing in China?
It's a great question. We want to know more about substance use in general among MSM actually in China, but the survey indicate that more than 95% of those who reported substance use were a rash pulper user, because in China, rash pulper was still considered recreational or illicit drug. So we didn't specifically ask the association or their intention, but we do find MSM who use pulper are more likely to get tested for HIV and STI, while HIV, the finding in HIV was in another paper. So we assume that men who use rash pulpers have higher knowledge or awareness of risk behaviors, and will be more likely to get tested.
Awesome. Okay, I think maybe I'll squeeze in one question. We might get booted off, but one question that I have is just, it's really fascinating, given that STIs are more prevalent than HIV in China, that the testing is sort of flip-flopped, right? Mm-hmm. Testing for HIV is more frequent among MSM. And I'm just wondering if that could potentially be that, folks who are symptomatic might actually get treated without getting tested for other STIs.
Yeah, I think that's a good question. That in the survey, we didn't ask them, whether they were receiving any treatment or following up care services from their provider. I think that is another limitation of this current study. But in China, as I mentioned, for people, those who get tested for HIV, they can get tested in like clinics or CBOs. But for STI testing, really, they will only be tested in hospital-based clinic. And most people, even though they have symptoms, they won't go to get tested, because like